I've had a lot of questions about Lindsay Vonn's injury that she sustained in Cortina during the Olympics. And I'm going to show you some of her photographs that she posted on her Instagram account. And then I'm going to show you some possibilities of what type of fracture she has involving her tibia. Her x-rays have not been released yet, so anything you're seeing online is just speculation. But I'm going to show you some different types of tibial fractures that she could have based on her clinical pictures. This is a picture of Lindsay with what's called an external fixator on, and it is attached to her tibia and also her femur. And it looks like an erector set, but these pins are actually drilled into the bone, and these pins are drilled into the bone. So we know that the fracture involves the tibia bone. Potentially could also involve the femur bone because this device spans both bones, her tibia, her knee, and her femur. Here is another view of her X-fix with less dressings on and without a sheet over it. And it looks like she has an incision here and an incision here, which would mean that she most likely had what's called fasciotomies. And we know she's had at least 4 surgeries. So when you have a tibial fracture, it can cause swelling of the muscle to the point where it swells so much that if you don't release the skin and the fascia, which is the tissue surrounding the muscle, it can cause the muscle to die. So she most likely had fasciotomies, and you need to go back every couple days to surgery to kind of clean those areas out. So I suspect she's had a fasciotomy from her really bad tibial fracture, just based on what I'm seeing as far as a dressing here and a dressing here. These dressings are around the pins that are holding her X-fix in position. So these look like these are the only 2 incisions that have been made so far. So if we look at different fracture options, this is what your normal tibia looks like. This is your tibia, this is your fibula, this is the knee joint right here. This is called a multi-segmental tibial fracture. There's a break here, there's a break here. It also involves the fibula. She may have this type of fracture. I'm suspecting that she doesn't because the external fixator pins were up a little higher. So I think her fracture is more around the knee joint, but this is how this fracture is treated with what's called an intramedullary nail, and we put screws, interlocking screws to hold the nail in place. This is a patient with an external fixator on place. I just wanted to show you what this looks like. So you can see these pins are driven through the bone. We literally drill a hole through the bone and put the pin in place. And this is the erector set that's outside of the leg. She could have something like this, but again, her pins don't go this far down her leg. So I think her fracture is closer to her knee joint. So I suspect she has more of what we call a tibial plateau fracture. Again, this is normal. This is a tibial plateau fracture where you can see this bone is broken, this is broken, there's a fracture here, there's a fracture going through here and one here. This area of the knee is called the plateau. So this is a normal tibial plateau. This is one that has a really badly what we call comminuted and more than 2-piece fracture. This is a way to treat it with a long plate and multiple screws near the knee joint to hold the bones back into position. This is just another example of a really badly comminuted tibial plateau fracture. So we'll know more in the next couple days. I believe she said she was going to actually release her x-rays now that she's back in the US, and then we can talk about what actually did happen and her recovery. I would state whether she had a multi-segmental tibial fracture or she had a tibial plateau fracture, her recovery is 4 to 6 months. If she had a tibial plateau fracture, which I hope she did not have, but if she did, this will result in post-traumatic arthritis in the knee because the cartilage has been badly damaged.